All right, how are you folks doing? I'm Jeffrey Potter. I'm a chiropractor doctor in Tomball, Texas. So I've been here since 2018 at this location. I have been a chiropractor in the state of Texas since 2004. It was the first state I licensed in. And I did go to school out of state, Kansas City, Missouri. It was Cleveland Chiropractic College. And so one of the things is just wanted to kind of give um, a little heads up what I do here. So, many times we're looking for a chiropractor, we're coming from out of state, we're moving here from maybe another part of town, but we're just not, we don't know anyone maybe well enough to get a referral, and we need something now. And so, just to try to break the ice a little bit so you kind of have a clue of who I am, what I'm doing. So I'm very experienced at this stuff, and I've seen a lot of problems under the sun, everything. So we're going to go through all kinds of complaints related to sciatica, pain, stiffnesses related to hip pain, knee injuries, ankle injuries, previous surgeries in different body parts, up to the shoulders, can range into elbow problems, tendonitis, tendinosis, all types of surgical repairs, things happening with people, the entirety of their system. Very, very experienced since 2004, have been practicing. So that brings me almost 19 plus years now. But it's not something to boast about or be all proud about. I think the main thing is to help you feel confident as a patient that I'm very experienced and that I'll likely be able to intervene in a way that's going to very much help you overcome your problem because maybe you've had success with this type of care in the past. Many chiropractors, they concentrate on kind of different ways of doing things. And so it's like, who does the same thing? And not really. So I think the adjustment is critical, that a chiropractor has skills to kind of adapt to each person's type of body type. And many times it can be tricky. And so the more skillful the chiropractor can start to adapt and kind of change to the person's type of skeleton, and then be able to modify and come in, and then that's where the skills come in. And it has a lot to do with a lot of different types of body types and working with a lot of different types of problems, where we begin to kind of figure out, oh, with this, then we can do that. And oh, if we have this, then that's what I need to do. And that's what brings more success. So it is a compilation of a bunch of experience that allows me to really, really, really lead majority of my patients into a sense of wellness they weren't getting with medical care, whether it's medication, interventional pain management, could be surgical correction, things like that. But I still can check in and bring that easement and more function. So the point of a chiropractor is we're just trying to get your range of motion intact without too much pain or complaint, especially levels you could tolerate. And many times, if you over that and you're into a complaint that's just not tolerable, you cannot move very well, you just cannot. Uh, if you could just get that range of motion going and get that severe kind of sharp pain hitting with that, just kind of get that out, things will be back to normal, even though you're not perfect. But that you need that at least, and that's not happening. And sometimes you'll go to a place and they're like, look, you need to come in 3 days a week for a month, for that. And so that's not something I think is necessary many times. I think, different scenarios need certain attention. And the one I just described is more commonplace. Where, like a car wreck, obviously you need to come for 3 days a week, couple of weeks, let's check up, see how your progress is, and make decisions then what else to do, and kind of keep going depending on how you're progressing. But, most of the time, though, you guys are dealing with pinched nerve, and let's hope it's only because of that. There's things that can make your neck hurt. You could get numbness in hands. You could literally be feeling tired and thinking you need to get an adjustment. Well, maybe, but it could be that keeps happening because you have hypothyroidism, and that causes those symptoms. So to keep adjusting the pain in the neck but not address the hypothyroidism is not a good thing. So I'm here to help guide you clinically, but also help you come out of your day-to-day ailments that aren't responding with home care, especially, and then or prescription or over-the-counter medication, or even stretching, strengthening on your own, if it seems exacerbating it, then I need to step in and help you. Things you can't do at the house is what I concentrate on here. So I concentrate on a Gonstead technique. I also concentrate on a motion palpation kinetic institute technique. And then I also concentrate on a decompression cox flexion distraction technique that is required to take this in school. It's 2 semesters. It's an elective, so none of us knew that it was required by law to have the course to be able to implement this kind of technique in your clinic. So I know there's a lot of chiros around here aren't doing what I'm doing in that regard. So with this technique, I'm able to stretch you and able to not only park yourself in a decompression state, but then I can stabilize the table, and then I can move in with leverage with my palm, my thumbs, my hands, to then further isolate the muscles, and then not only stretch them, but strip and then compress with a type of Nemo travail or trigger point type method. We've had all of these different things, but have we had them in a combined situation? And that's what cox flexion technique really opens up and allows us to do. And we see much more greater results when we're trying to resolve a tensive muscle spasm. And so if we're just going to just kind of say, well, I got decompression, I do that at my clinic. Well, is it decompression in just one angle, or is it in all 3 lateral bend, rotation, and flexion extension axes that your spine does all these different ranges? And you cannot just address one angle, the pull, which is pretty common in clinics. You must address all 3 axes. And this will address all the different muscle groups and really start to get limberment, blood flow, oxygen counts up, and really start to see this inflammation over the next 4 or 6 days just start to diminish into levels that you can be very functional and very appreciating that visit at my office, and then realize there's no real reason to be coming in here a bunch of times. Now, I know some people are thinking, well, I want to be an Olympian athlete and be very flexible and get into a routine with physical therapy or with a trainer. Well, I would advise, let me help you out for a minute. Let's make sure that you're not going to kind of flare in a serious pain stage because you weren't ready for that serious routine of exercise. But I'm not the exercise guy. I can give you pointers, give you some experience of mine, stretching tactics to really get control of these ailments. So I'm kind of the ailment guy, but so that you can get back to your normal things, normal exercises. I'm not the exercise guy that owns a gym. So although I love the gym, I'm not talking down against it, but that's not my scope here. My scope is clinical, and if you can't get the things that you can't buy because you don't have a license is what I have, and those are the things I concentrate on, because if you can't buy it and I can, then I want to be that guy that gives you this. You deserve it, and it's kind of hard to find this around here. I've seen a lot of facilities kind of concentrating on things that we can already buy on our own. So we're kind of wasting time on this. So those are home care tactics. I don't want to deliver home care tactics here. I want to do what a credential allows you to get, and it's clinical level care, and it is very much necessary as insurance pays for these things, as there's a diagnosis of malalignment, there's a muscle spasm related, and we're having nerve irritation, inflammation. So all these different things are happening histologically. We're talking at the cellular level in your muscles, tendons, blood, different departments that are having issues, that the different things that I'm doing are addressing all those different issues. So we're not just adjusting the pressure off. In fact, we're going to go in and start trying to facilitate nerve to start circulating with blood and muscle. If we don't have a nerve being rehabilitated to circulate properly, the muscle's going to keep locking, and you're going to keep needing that adjustment. So, to think I'm going to go to this clinic and just get an adjustment and then be all well, you're neglecting all the different other 4 other tissue departments of the joint and its pressure problem, where I want to address all of those 5 different components to a malalignment subluxation complex, and then we will start to see extreme real progress. And in fact, the only thing that brings patients here is those results and when they need it. And they just know when they're coming back, they're very confident that since the last visit resolved it, and if it's starting to creep back, they'll come back in as needed. And they know that, oh, when they're on their way here, that they're about to resolve it. So to have that kind of place to just rely on when you need it, and it doesn't need to be that many office visits, typically 1, 2 visits within a week or two. I've got you guys narrowed down, being over it. And so that is awesome. To be able to have that kind of a place to rely on is nothing like it. And so let me just take you around the clinic for just a moment, just to give you a little heads up where we're at. So right now I'm in my office.